February 12th, 2026. Angela, if you'd like to do the prayer for us, please.
Good afternoon, everyone. Let us pray. Gracious God, we thank you for the opportunity to serve at JPS. As we gather, help us align our goals, guide our discussions, and encourage us to communicate with kindness, listen attentively, and act with clarity and courage. Renew our commitment and inspire us as we work to grow the JPS Health Network in ways that honor and serve all. Amen. Please stand with me for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this point, we have no citizens here to speak? Okay. Motion to approval of Joint Board Manager Finance Planning and Investment Committee meeting minutes.
Move approval.
No further discussion? All in favor?
Aye.
Opposed? Motion carries. Board Chair report. As you probably noticed, DT and Dustin are not here, and they've asked me to attempt this position, and I will do my very best. One thing I'd like to introduce is our new board coordinator, hiding over there. There she is.
Hi there.
SB is what you're going to call her. So good to have you with us. Also, I'd like to, about a week or so ago, we had bad weather. A lot of companies didn't show up. My company did not show up. I was the only one who showed up that morning. Not very happy with them. But guess who did show up in force? The staff here. Never slowed down, never missed a beat. People get sick, people get hurt, and they depend on us being here, and our staff did it. So I'm very proud, very proud. At that point, I'd like to move to you.
Thank you, Mr. Chair, and welcome, SB. So just a few updates of what's going on around JPS. Okay, we're going to go ahead and get loud. And as Mr. Chairman has shared with you, it's really hard to believe, given the sunshine that we have and the warm weather that's come on the back end of this winter weather. But I do want to take this time to thank the team that prepared for the winter event. It was led by Joy Parker, who is our Senior Vice President over Operations. But she really led the team through about 4 or 5 days of ice around here. I also want to thank our HR team for providing lodging, beds, and food for our staff that stayed overnight, but really does speak to the dedication of the JPS team. So thank you to all of our providers and our staff who helped us maintain great care and seamless operations during that time. So thank you. Okay, so we work hard, but we also play hard. And we actually, last week, held JPS night at the Rodeo Stock Show. And I want to thank our foundation for having the pre-barbecue dinner for the staff before the show. And so you can see some of our team members here dressed in their cowboy hats and boots. Also want to thank those board members who attended the ribbon cutting for the Thrive on Crawford. This, for me, is really a career high in being a part of this great partnership that will provide affordable housing, not only for our workers here, but also for our community. And so I'd like to thank the board members that attended that. Of course, you can see DT there. You see Reverend Emerson there, Blake, you see there, Dustin was also there. And I would especially like to thank Trent Petty, our former board member, and Daphne Walker for the hard work that they did behind the scenes for a number of years and have really given us an outstanding product that will live on forever. Okay, we are beginning to start our 2030 strategic planning. For those board members who were here shortly after COVID, we had completed our last strategic plan in 2021. And so we will start planning for the next 4 or 5 years. We are doing some pre-work and doing a lot of community engagement and holding stakeholder meetings. And I wanted to bring this up because TJ back there, Grassetti, who oversees our strategy and business development, will be reaching out to board members to schedule time so that he can begin to share with you where we currently are in our healthcare environment here, and to hear your voice and get your thoughts as we begin new strategic planning for JPS. So probably Lonnie or Espy will reach out to you, but TJ will lead those sessions. We did complete about a 4-hour session with our executive team led by TJ. That was a great session in which we heard from our executives. We will then hear from our board and then also from our physician group. So, and last but not least, we are taking time this year really to delve into our communities and to be able to really carry out our mission, which is transforming healthcare delivery in the communities that we serve. But this will give us opportunity to really understand the communities that our patients come from, and also to be able to direct our work to help improve the outcomes of the community. And I had opportunity to actually be out in the Stop 6 community and held our town hall from the Stop 6 community, and just wanted to give the board a little bit of insight for those of you who are not familiar with the Stop 6 community. I know Reverend Emerson, that is your home ground, but I wanted to give you a little insight into one of our communities, which is called the Stop 6 community.
We opened in '94. My name is Janelle Williams. I've been at JPS for 45 years now. When I first started out as the practice manager, we had, I want to say, 13 residents, and we had 4 staff providers. We now have a total of 30 residents and 14 staff providers. Back in the day, Stop 6 used to be the 6th train stop when we had electric train cars. It used to be a neighborhood in which people did not want to live here. And it was because we had a lot of gangs. I was just so excited, that we were having a clinic out in the Stop 6 neighborhood. And I lived out here as well and went to school. So it was exciting to see something develop that was much needed in this neighborhood. We had a lot of sick people. They had no transportation. They didn't have any resources. And the community, I'm going to tell you, it was just, they were here every day. It was like it was a show outside. It was something new, something needed, and they were just very happy that we were bringing a community health center to the Stop 6 area. Walter B. Barber, she is who the clinic is named after. She was one of the board members, and it was very important because we had a lot of predominantly black people in the neighborhood that just was not getting the health care that they needed. And she was like, no, we need something. We need to bring the health care to our patients that are out in the communities that don't know anything about health care. Because we have established this clinic in the neighborhood and have presented it in a way where it's not something you can be afraid of. It's something that we're trying to help you.
Okay, that was put together by our communications team. Amazing. It was narrated by Janelle Watkins, who, as she said, has been at JPS for 40 years. She was actually born at JPS. She met her husband at JPS. Her swing set, because she grew up in the Stop 6 community, actually faced JPS. So even when she was a little toddler on her swing set, she would see JPS from afar. This is a true community clinic. We have several that are truly embedded within the community. The community understands the value and importance that health care site provides. And so I'm just really proud of the work that goes on in the community. So with that said, a little bit about Stop 6. Last year saw over 34,000 encounters, has a wealth of services that are provided out there, from pediatrics to adult to women's health. In fact, last week, I think it was last week, I revisited out there because we had started our centering program and our women's health program there. It also has family medicine residents, about 26 that rotate through there, and has both faculty, of course, our clinicians, and our APP that provide care out there. So a great place. If you've not had a chance to visit, please visit. So with that, Mr. Chair, I will turn it back over to you.
Thank you. Dr. Kirby, if you'd like to give us a report from the medical executive staff.
Absolutely. Thank you, Chair. You will notice in your red folder, I have a memo from the MEC. This is an ask of approval for medical staff appointments and privileges.
Move to approve.
Second.
Any further discussion? All in favor?
Aye.
Opposed? Motion carries.
Thank you.
Committee reports and action. I think, Dorothy, you're going to give us the quality and patient safety.
Yes, the Quality Committee met January 22nd, and Dr. Assad opens all of those meetings by doing a compelling patient story, showing what care they've received. And this one was illustrated the transformative impact of a minimal invasive transaortic valve replacement, a TAVR, for a patient with a life-threatening heart failure. The patient underwent the procedure without the need for open heart surgery, recovered rapidly, avoided prolonged hospitalization, and returned to the independent living. That's really a great improvement because for us in providing that service. They did the 2025 cultural safety results. They reviewed results from the 2025 cultural safety survey, which achieved an exceptional 97% participation rate with approximately 5,900 respondents. The organization achieved an overall mean score of 4.17, placing it in the 85th percentile nationally. So their ongoing efforts is to further strengthen the clinical information flow across the team were also discussed. They did a key component of the network strategy scorecard was presented. It currently measures include the NTSV C-section birth rate, unplanned 30-day admission, PSI 90, and hypertension control. Progress to date and associate actions planned to drive continuous improvement across these domains were reviewed with the committee. They have a scorecard that shows the improvement, and then the ones that they are focusing on is in a different color. So it's really a great report. They are tracking over 34 metrics across 7 domains. They highlighted quality control meeting was shared, including updates across key operational clinical areas such as utilization management, the operating room, emergency department performance, laboratories, service, environmental care, and life safety and behavior health. That concludes my report.
Thank you. I'll be giving the foundation report for both November and January. On November 6, 2025, meeting served as an introduction of the new foundation board members and an update on the annual foundation priorities. We began the meeting with a mission impact update. The foundation continues to drive meaningful community impact through our partnership with True Worth Clinic. The annual dedicated Women's Health Day served 226 women experiencing homelessness, making a record year and demonstrating continued effective collaboration in addressing critical community health needs. On governance and leadership, the foundation welcomed 5 newly appointed board members and elected the board officers. And we discussed foundation strategic priorities, including focusing on expanding community engagement and visibility, advancing fundraising excellence and sustainability, strengthening organizational culture, and increasing foundation board engagement to support long-term system goals. Obviously, I didn't write this. It's very professional. Okay. On January 30th, 2026, we started by receiving an update from CFO Kim Hodgkinson on financials ending December 31st, 2025. The foundation has begun the year ahead of budget, led by strong grant performance coupled with positive investment returns. The board was provided with comprehensive overview of the MFP by Network COO Jill Farrell. Many board members are new and had limited knowledge about the completed scope of the project. Jill walked the foundation board through the timeline, facilities, transformation taking place in the hospital district and throughout the county. We also discussed key fundraising initiatives. Obviously, MFP is the main focus on the foundation team. We were sharing how all of us are able to specifically engage to support the team's development efforts coming. The foundation is also hosting the inaugural golf tournament, April 13th. Everyone should be involved with that, please. I have information how you can support the tournament and be among the first to play on the newly redesigned course. The foundation team is also planning additional events throughout the year to meet its strategic priorities of expanding community engagement and visibility, advancing fundraising excellence, sustainability, strengthening organizational culture, and increasing foundation board engagement to support long-term system goals. Thank you. Reports and updates. The artificial intelligence, that is going to be tabled till the next meeting while we have a few more board members here at that time. And I think we have nothing when considering matters requiring board actions at this time. And to the best of my knowledge, anything else we need?
No, we don't have a consent agenda for today. All those items were approved. We have one item for close.
Okay. At this point, it's 1:30. We're doing very well. If we can take 5 minutes and reconvene and close the executive session, please.
Okay.
Yes.
That's what I just said.
I thought we were friends.
Alan, go ahead and close the.
Ralph, I just.
It was production crew back in.
Oh, yeah.
She gives you the thumbs up. Go.
We'll now reconvene open session. It is now 2:06. If there's no further business, we stand adjourned.
All right, thanks.